What if the blood pressure reading your doctor waved off as nothing to worry about is actually the exact number linked to silent strokes in people over 60? And what if the reading that scared you into a new pill was never the real danger at all? Before I explain that, do one small thing for me. Tap like, hit subscribe, and send this to the one person in your life who checks their blood pressure and just shrugs at the number. That single tap might be the reason someone catches a problem early instead of too late. Here's the truth nobody tells you plainly. Most people past 60 are not confused about whether a number is high. They already sense that. What they are actually confused about is what high even means once a body has been running for 6, 7, 8 decades. A number that would be alarming at 35 might be completely normal at 68. A number that looks fine on paper might be quietly wearing down an artery for years. That gap in understanding is not a small detail. It is costing people their independence, their memory, and in some cases, their lives. So today, I want to give you something different from the usual 5-minute doctor's office speech. I want to give you an actual framework, not a vague keep an eye on it. A real evidence-based way to know exactly where you stand based on your age, your body, and your risk. And near the end, I'm going to show you a hidden number buried inside every single blood pressure reading you have ever taken. Almost nobody calculates it, yet research shows it predicts stroke risk better than the 2 numbers your doctor actually writes on your chart. Stick around until the final section too, because there's a specific window of time each day when blood pressure quietly does the most damage. Most people have never even measured it. Once you understand it, you may never look at your morning routine the same way again. Let's start with why this is so confusing in the first place. For most of your life, blood pressure worked a certain way. Both numbers moved together. If the top number went up, the bottom number usually went up with it. Simple, predictable. Then, somewhere around your 60s, something changes, and almost nobody explains what. Every reading gives you 2 numbers. The top number, called systolic pressure, measures the force of blood slamming against your artery walls the instant your heart squeezes and pushes blood forward. The bottom number, diastolic pressure, measures the pressure sitting in your arteries between heartbeats while your heart is relaxing and refilling. As you age, your arteries change physically. The stretchy, elastic tissue inside artery walls slowly stiffens. This is not something you did wrong. It is simply what happens to tissue over time, the same way skin loses elasticity or joints get stiffer. Doctors call this arterial stiffening, and it changes the entire relationship between your 2 blood pressure numbers. Here's what happens. A stiff artery cannot expand and cushion the pressure wave the way a young, flexible artery can. So every time your heart beats, the force hits harder and your systolic number climbs. At the same time, a stiff artery does not spring back and hold pressure between beats the way it used to. So your diastolic number often drops, or simply stays flat while the top number rises. The result is that your 2 numbers start pulling apart from each other. The top climbs, the bottom holds steady or falls. Doctors call this pattern isolated systolic hypertension, and it is by far the most common form of high blood pressure in people over 60. It behaves completely differently from the blood pressure problems younger people usually get, where both numbers rise together. This matters more than most people realize. Large studies following thousands of adults over decades have found that a high systolic number on its own is dangerous. Even with a completely normal or low diastolic number, it is one of the strongest warning signs for stroke, heart failure, and cardiovascular death. So if a doctor glances at your reading, sees a calm bottom number like 70 or 72 and says, "Diastolic looks fine, don't worry," that reassurance is incomplete. The top number can still be quietly damaging your arteries, even while the bottom number looks perfectly innocent. Now let's get specific, because vague ranges do not help anyone protect themselves. One of the most important pieces of research shaping how doctors treat older adults today came from a large clinical trial that enrolled over 9,000 adults, most of them past 60. Researchers wanted to know something simple. Does pushing blood pressure lower actually protect people, or does it just look good on paper? The answer was yes, lower systolic pressure did reduce heart attacks, strokes, heart failure, and death. But the same research also found something important that often gets left out. Pushing numbers too aggressively lower increased the risk of kidney injury. It also increased fainting spells and dangerous drops in blood pressure upon standing, especially in adults past 75. In other words, lower is not automatically safer. There is a real thoughtful balance here, not a race to the smallest possible number. So here are the ranges that actually matter based on that research and what has held up since. If you are between 60 and 74 years old, a systolic number under 130, measured properly at rest, is your target zone. A number between 130 and 139 is acceptable, but worth watching closely. Between 140 and 149 is an early warning zone. Not an emergency, but a real signal that lifestyle changes and a serious conversation with your doctor are overdue. A systolic number of 150 or higher, showing up consistently over 2 weeks or more, is genuinely too high and needs medical attention. If you are 75 or older, the general target is still under 140, but how hard you push toward that number depends heavily on your kidney health. It also depends on your risk of dizziness or fainting when you stand, and your overall condition. A systolic reading of 150 or higher, showing up consistently, is too high regardless of age or how you feel in the moment. Now the bottom number, under 80, is considered ideal. Between 80 and 89 deserves watching. 90 or above, showing up consistently, means your arteries and kidneys are under real, sustained strain. But here's the part almost nobody warns you about. A diastolic number below 60 is also dangerous in older adults. This is the direction of risk that almost never gets discussed, because everyone is trained to think lower is safer. Research following older adults over years found that a diastolic number consistently under 60 was linked to hidden heart muscle damage. It was also linked to higher rates of coronary heart disease. Not because pressure was too high, but because there was not enough pressure between heartbeats. There was not enough pressure to properly feed the heart muscle itself with blood. A separate study confirmed that in older adults with the stiff artery pattern we just described, a diastolic number at or below 60 independently predicted a higher risk of death. Before we go further, it helps to understand why arteries stiffen in the first place, because this is not random bad luck. Years of exposure to salt, stress hormones, inflammation, and simply the wear of decades all play a role. Every high-sodium meal causes your body to hold onto extra fluid, which increases the volume of blood your heart has to push through already stiffening vessels. Chronic stress keeps cortisol and adrenaline elevated more often than they should be. This keeps blood vessels slightly more constricted than they need to be, day after day, year after year. Poor sleep does something similar, disrupting the natural nighttime dip in blood pressure that healthy bodies rely on to give arteries a break. None of this means high blood pressure is your fault. It simply means it is not one single thing. It is the sum of small pressures, repeated for decades, finally showing up on a small cuff around your arm. This is also why lifestyle changes still matter enormously after 60, even if a part of you feels like the damage is already done. Reducing sodium intake, even modestly, can lower systolic pressure by several points within weeks. Regular walking, even short daily walks, improves how flexible your arteries remain over time. Better sleep habits help restore that natural nighttime dip that protects your heart and brain overnight. None of these replace medication when medication is genuinely needed, but they work alongside it. In some people, they meaningfully reduce how much medication is required at all. Let me tell you about a patient I'll call Margaret. She was 76, a retired schoolteacher, and she came in exhausted, dizzy, and worried something. Her top number looked great, sitting around 124. Her medication had done its job on paper, but her bottom number had quietly drifted down to 52 over several months. Because she was on multiple medications, all pushing in the same direction, her heart simply was not getting enough blood flow between beats. Once we adjusted her medication and brought that bottom number back up to around 66, her dizziness disappeared and her energy came back within weeks. Nobody had been watching the bottom number. Everyone was so focused on keeping the top number down. They had accidentally created a brand new problem underneath it. Watch both numbers, not just the one that scares you. If you're finding this useful so far, drop the word watching in the comments. It genuinely helps me understand who is here and what to cover next. Now, let's talk about the number almost nobody calculates, the one I promised you at the start. It is called pulse pressure, and it takes about 5 seconds to figure out. You simply subtract your bottom number from your top number. If your reading is 148 over 78, your pulse pressure is 70. If your reading is 132 over 82, your pulse pressure is 50. That single gap between your two numbers turns out to be one of the most powerful predictors of heart attack and stroke risk in older adults. It is arguably more powerful than either number alone. A major long-term study following thousands of people found that once someone passed 60, pulse pressure was key. It predicted major cardiovascular events better than systolic or diastolic pressure by themselves. The same research found something almost nobody expects. Past 60, a lower diastolic number was actually associated with higher risk. This means a wider gap between the two numbers was more dangerous, not less. Why would that be true? Because pulse pressure is a direct real-time snapshot of how stiff your arteries have become. Stiff arteries push the top number higher and let the bottom number sink lower. The wider that gap gets, the harder your heart has to work with every single beat. More mechanical stress gets placed on your arterial walls, including the very arteries that feed your heart muscle. Here are the ranges worth knowing. Under 40 suggests your arteries still have good elasticity. Between 40 and 60 is acceptable, but worth tracking over time. Above 60 is a genuine warning sign of arterial stiffness and elevated risk. Above 80 is a serious signal that deserves real attention. Here is why this matters so much in practice. Imagine a reading of 165/75. Most people, and honestly most doctors in a rushed appointment, will focus entirely on that 165 and feel alarmed. But the pulse pressure here is 90, an even stronger warning sign that the artery walls themselves are under severe mechanical stress. That number deserves just as much attention as the top number, sometimes more. So here is something practical you can do right now. Pull up any blood pressure reading you have from the last week or two. Subtract the bottom number from the top, write it down. If it comes out above 60, bring it up with your doctor directly. Ask specifically what it means for you. Most doctors will not raise this number on their own initiative. Now you can. If you're still with me, type the number 3 in the comments. It tells me people are actually following along, which shapes what I make next. Now let's talk about the part of the day that almost never gets discussed, even though it may matter more than any single reading you take. Blood pressure is not a fixed, constant number sitting quietly inside you all day. It moves, sometimes dramatically, hour by hour. And there is one specific window when it is known to spike hardest in older adults, a window most people never think to measure. It is the 2 hours right after you wake up. In the moments after your eyes open, your body releases a wave of cortisol and adrenaline as it shifts from sleep into activity. Your heart rate climbs. Your nervous system shifts into a more alert state. In younger, healthier arteries, this morning rise is gentle and easily absorbed. But in older adults with stiffened arteries, that same morning surge can be dramatic, sometimes 20, 30, even 40 points above your overnight baseline. Research tracking stroke and heart attack timing found that the hours between roughly 6 in the morning and noon account for a large share of these events. The morning surge in blood pressure is considered a major driver of that pattern. One notable study following older adults with high blood pressure found that those with a sharp morning surge had nearly 3 times the stroke risk. This was compared to those whose morning rise was gentle, even after accounting for their overall daily average blood pressure. Here is what that means for you practically. If you only check your blood pressure once a day, you may be missing the full story. If you happen to check it in the afternoon or evening, you may be measuring your calmest, safest window and missing the dangerous one entirely. A reading taken within 30 minutes of waking, before coffee, before medication, before you have even gotten out of bed, tells a far more honest story. I once worked with a retired engineer named Walter, 73 years old. His afternoon readings sat comfortably around 130/76. By every normal standard, he looked well controlled, but something told me to check further. I asked him to measure 3 times a day for 2 weeks, right after waking, at midday, and before bed. His morning readings averaged 156 systolic. The very same man who looked perfectly fine every afternoon was quietly running dangerously high. This lasted for the first 2 hours of nearly every single day, right through breakfast and his morning walk. We simply adjusted the timing of one medication to provide stronger coverage overnight and into the morning. Within weeks, his morning readings dropped to the low 130s, while his afternoon readings barely changed. If we had never checked the morning, we never would have found the actual problem. If there is one habit to build from this entire video, it is this. Check your blood pressure within 30 minutes of waking before anything else. It may be the single most revealing reading you take all day. Before we go further, if this is genuinely giving you clarity, hit subscribe now, not later. This channel grows one honest, informed person at a time, and your subscription helps someone else find this exact information when they need it most. Now, everything we have covered depends on one assumption, that your readings are actually accurate, and that assumption fails far more often than people realize. There are 5 extremely common mistakes that quietly inflate blood pressure readings, sometimes by 10 to 20 points each. Stack a few of them together and you can add 30 or 40 false points onto a number that never actually reflected your real blood pressure at all. The first mistake is measuring without resting first. Blood pressure rises immediately with any physical movement. Guidelines recommend a full 5 minutes of quiet, seated rest before taking any reading. Most people skip this entirely. The second mistake is measuring over clothing or letting your arm hang unsupported. The cuff needs to sit on bare skin. Your arm needs to rest at roughly heart level on a table or armrest, not dangling by your side and not resting in your lap. Letting your arm hang down can alone add 8 to 10 points, simply due to gravity pulling blood downward. The third mistake is using the wrong cuff size. A standard cuff on a larger arm will consistently produce falsely high readings. If you are unsure what size cuff you actually need, ask your pharmacist. It matters more than most people assume. The fourth mistake involves small things people barely think about. A full bladder can raise your systolic number by 10 to 15 points on its own. Crossed legs can add another 5 to 8 points. Talking during the measurement, even casually answering a question, can add another 10 points or more. Add those together, and you are looking at potentially 25 to 30 extra points, entirely from things completely within your control. The fifth mistake is trusting a single reading. Blood pressure naturally varies from moment to moment. so one isolated number means very little on its own. The better approach is 2 readings, 1 minute apart, using the lower of the two, and tracking this pattern over at least a full week. So here is the simple, correct routine worth adopting. Rest quietly for 5 minutes, feet flat on the floor, back supported, arm bare and resting at heart level. Take 2 readings, 1 minute apart. Do this twice daily, once within 30 minutes of waking and once in the evening, for 7 consecutive days. Average all of those readings together. That average, not any single number from a rushed office visit, is what should actually guide decisions. One question I get constantly is this: when does a high reading simply need watching, and when does it need an ambulance? Here's the honest way to think about it. But before we get to that, it helps to understand what actually happens inside your body. Your kidneys contain tiny, delicate blood vessels that filter waste from your blood every single day. Sustained high pressure gradually damages these tiny vessels. Your eyes contain similarly delicate vessels at the back of the retina, and an eye doctor can sometimes spot early blood pressure damage. Your brain relies on small, thin-walled vessels deep inside it, and these are especially vulnerable to the kind of pressure spikes we have been discussing. Small areas of brain damage that produce no obvious symptoms at the time are closely tied to poorly controlled blood pressure in people over 60. None of this is meant to frighten you. It is meant to explain why the numbers on that small cuff matter so much more than they seem. A high number without any accompanying symptoms is a signal to respond calmly, not to panic. Sit down, rest for 10 minutes, breathe slowly. In most cases, a number that looked alarming drops meaningfully after genuine rest. Stress alone can temporarily spike a reading by 20 or 30 points. A high number paired with specific symptoms is an entirely different situation. If your systolic is above 180 or your diastolic is above 120, take notice. If you are experiencing specific symptoms alongside those numbers, this becomes an emergency. Call for help immediately. The warning symptoms are these: a sudden, severe headache unlike anything you have felt before, chest pain or pressure, sudden trouble speaking or understanding speech, sudden vision changes or partial loss of vision, numbness or weakness on one side of your body, sudden, severe difficulty breathing. These symptoms alongside a dangerously high reading suggest organs are being damaged in real time. Minutes genuinely matter in that situation. But here is the reassuring flip side. Plenty of people occasionally see high readings with absolutely no symptoms at all. That situation does not require an emergency room visit. It requires calm remeasurement and a same-day or next morning call to your doctor. Knowing this difference, a spike versus a genuine crisis, can save you from years of unnecessary worry, or it can save your life. Let's bring everything together. I want you to leave this video with something you can actually use starting tomorrow morning. Too high was never a single number. It depends on which number you're looking at and how consistent the pattern is. If you are between 60 and 74, aim for a systolic number under 130. Watch closely between 140 and 149. Anything at 150 or above showing up consistently needs real medical attention, regardless of age or how you feel. Your diastolic number above 90 is too high, but below 60 is equally dangerous, and almost nobody watches for that. Calculate your pulse pressure, the simple gap between your two numbers. Under 40 is healthy. Above 60 deserves attention. Above 80 is a serious signal. Remember the morning surge, the 2-hour window after waking, that quietly causes more damage than any other part of the day. Remember the 5 silent measurement mistakes that can add 30 or more false points to any reading. Remember the correct way to measure. 5 minutes of rest, bare arm at heart level, 2 readings twice daily, averaged over 7 days. And remember the difference between a spike and a crisis. A high number alone calls for calm and remeasurement. I want to ask you honestly, have you ever actually checked your blood pressure within 30 minutes of waking up? Tell me in the comments. If this video gave you clarity, subscribe, tap like, and send this to one person you love who just shrugs at whatever number appears. Your blood pressure reading was never meant to be a verdict. It is simply your body's way of talking to you. Today, you learned how to listen,